my colleague Andrea Horvath Marquez, our new program chief for mental health disparities. We'll be telling you a little bit about some priorities for NIMH, including around suicide prevention in Native youth.
Thank you.
Andrea.
Thank you so much. I'd like to thank you, the group, the Health and Wellbeing Collaboration Team, for inviting me, Roberto. And I will be sharing with you a little bit about NIMH, and particularly about our program here on mental health disparity research, and some of the collaborations that we are doing regarding to American Indians and Alaska Natives. And it was very nice to hear about Angela's work, and I think it would be very nice for us to talk later about our new collaborations that we can move on. So, so I'm just going to talk a little bit briefly. I don't know, just a really overview about our mission, our office. And I'm going to be focusing on mental health disparities research priorities. And I'm going to emphasize just 2 examples of programs that we are moving on here now. So I think as probably you're all familiar with the mission of NIMH of understanding the treatment of mental illness through basic clinical research, paving the way to prevention, recovery, and cure. And on that way, I think I just want to emphasize that now a new NIMH director that started in September last year, and he's having this view of emphasizing diversity in our research, not only regarding to the subject matter itself, going all the way to basic to implementation science, but also pushing agendas to the workforce and also to individuals, different race and ethnicity, to be participating in the research. And that's helping us a lot to move our disparities agenda with him. With that, he has pushed 3 new priorities, and one of them is suicide prevention. I'm emphasizing that because that's the agenda that we are talking right now, and that's going to be very helpful and important for us. So, but all those 2 other areas are also emphasizing at NIH right now, and they are having a lot of meetings and pushing new FOAs regarding to computation, psychiatry, and neural circuits. But suicide prevention, I think it's our agenda right now in this meeting. And I just want to also emphasize that mental health disparities is also part of the one of the NIMH strategic plans, and that became very important in the last few years, and so it's helping us to spread our office here. I have to say that I am here for just 4 months in this office, so Roberto is here a little much longer than me, so he will also be able to share with me and help to answer some questions that I may not be still aware. But so our office, the Office of Research for Disparities in Global Mental Health, oversees all those just different kinds of research: mental health disparities, global mental health, women mental health, and also Office for Rural and Mental Health Research. So I'm going to emphasize some aspects of the mental health disparities research that me and Roberto are leading here. And our 3 main priorities in this office is to understand mechanisms of disparities through study diverse kind of groups, to develop new interventions to reduce disparities in optimized care, and also to track disparities. I'm going to emphasize today how we're going to scale up evidence-based interventions to reduce disparities in access of care. So that's going to be the 2 examples that I'm going to provide you now about how we are doing that. And I'm going to emphasize just 2 examples here. One is a collaboration with federal partners that we are doing right now, and we, as we are working with HRSA and implementing collaborative care, and the other one is the collaborative hubs to reduce suicide in American Indians and Alaska Natives. So the first one is the collaboration with federal partners. We are pushing this agenda. NIMH with HRSA are partnering in a program, and we are supporting HRSA in implementing collaborative care in HRSA NERD health clinics to expand the use of collaborative care. So for some people who are not so familiar with collaborative care, is a systemic approach to improve care for depression and other common mental health disorders, in which primary care and mental health disorders, workers work together, generally in a primary care facility. The NIMH and other agencies had already funded a lot of RCTs, and we have has been shown how collaborative care is very effective and cost effective to reduce to help for depression, anxiety, suicide preventions, and other mental health and medical conditions. And we are very happy that this project is probably going to be starting now in August, this agenda. So we are going to be helping to implement training for those nurse clinics that HRSA is funding. So we are going to be helping them to train and evaluate that training and compare that to use care. And then as collaborative care has already been recognized by different agencies, and it's really going to make a very, I think, an important impact in general for mental health, and definitely we're going to be pushing for suicide prevention as well. And another important event that we are pushing right now, and I'm very happy to tell you that that's going to be starting now in July. NIH had last year there was a FOA for for the what we call collaborative hub to reduce the burden of suicide among American Indian and Alaska Native. And as you all know, and you are familiar to the very sad rates that we all familiar with, how high the highest rates of suicide among Alaska Natives and American Indians, and mainly in youth. So this FOA was released, and we're happy to say that now we have 3 new grants that are going to be starting in the next month, and the goal of this hub, this collaboration is to develop and scale up suicide prevention programs, to determine the mechanisms and risk and resilience, and to determine how to improve with fidelity effective suicide prevention programs. So we're going to have building capacity building aspects. We're going to have a dissemination aspect, and there's going to be a research study that's going to be going on. We're going to have one study that is going to be in Alaska, and then 2 other studies that's going to be in an American Indian communities. So I'm going to share with you this one that was already a few days ago. There was Stacy Rasmus, Lisa Wexler, and James Allen were the first one to receive the grant. And this study is going to be in 3 regions in Alaska, as you pointed here, in Northwest Arctic, Norton Sound, and how you say that? I'm sorry. Okay, and it's easier. So those and you see the rates of suicide are extremely high, and we are very happy that they are going to be the first one to start the study. It's going to be a cross-sectional mixed method study of youth between 15 and 29 years old. And their goal is to identify community-level protective factors that are associated with social determinants of suicide disparities. They also aim to develop and disseminate a practical tool in Alaska communities, what they call Alaska Communities Resilience Mapping, to prevent suicide. And what I think it's also very important about this hub is that we're going to have a club, it's going to be a hub, so the 3 groups are going to be working together. We're going to be having meetings together, and our goal is for them to promote dissemination of the findings and to be implementing and sharing. So I think it would be very nice that we're going to be having these meetings, and I would be welcome everybody who'd like to meet us with us, and definitely we're going to have one meeting a year in different regions, and we're going to be inviting you to participate and provide us some inputs. Roberto and I, we're going to be working in this project, and we are very glad. Our goal is to save lives, to develop effective community-informed interventions for research. And I think that's going to be, it's a very important time for this agenda, as we're going to be able to prioritize the agenda of suicide prevention that NIH is having right now also, and certainly the HHS Tribal Behavioral Health Agenda. And this study is being funded by NIMH, this collaborative hub, but also NIMHD is collaborating with us. So I'd like to thank you them. And I welcome everybody to join us to this adventure that's going to start in a month. Thank you. Any questions? I'll be happy to answer. There are other different programs that we are pushing now, and I'll be happy to share with you later. But I emphasize the ones that I thought it was more related to this talk.
Thank you very much, Andrea. And I'll also just add, I guess, that I'll be involved as well as a project scientist on 2 of the hubs. Andrea is the program officer, sort of dealing with all the administrative responsibilities. And I get to play a little bit with the science and the research team. So I'm really looking forward to that opportunity. Does anyone have questions for Andrea?
Andrea, have the other 2 hubs been identified and announced yet?
One was yesterday, so now I can say one is going to be as Mary Swick from Johns Hopkins University, and the other one is going to be in July, so I cannot. And if everything goes fine, it's going to be the 1st of July. So then I'll be able to have. We're gonna have a website, and I'm gonna share with you on the links too. And then we are also happy to say that in July and August we're gonna have some webinars from NIMH, from our office, in global mental health and mental health disparities. And one of the webinars is going to be about the hubs that we're going to start, and the other one is going to be Roberto.
So yeah, right. So the other webinar will be on building resilience in the Arctic for suicide prevention, and once we have the confirmed dates and times, we'll announce that widely through the collaboration and other networks. All right, anyone else?
Just real quick, yeah, thanks for the overview. I've been waiting for the collaborative hubs to be announced and awarded. I know that there's lots of room for collaboration. I definitely have worked with communities all over, like the Norton Sound or Yukon Kuskokwim, of course, with Lisa and Stacy, and also Mary Swick with White Mountain Apache. So I know that I have the funding opportunity announcement for the collaborative hubs. I haven't studied it that much, so I know that there's probably certain things that research that you're collecting, which may be similar. I'm curious, because we're collecting, information too, and how does that look like for communities that have all of these different grants going on, and how are the data here and the data there. So it's just, yeah, I look forward to some sort of collaboration.
Yeah, as you were talking, I was excited to hear and to see how we can collaborate, and I think it's gonna, and definitely as you know, I'm waiting, we are working hard here to start those, and we have 2 of them. Yesterday was the 2nd, and the 3rd one is coming. So once we have the 3 of them together, then we're gonna spread, and we're gonna start working hard to collaborate even more.
Great, thank you.
Good. All righty. We're at our time, but I do want to just allow a minute or 2 for anyone who has some updates or want to share announcements at this time. No?
Maybe I'll share something. One of the activities I've been involved in is the co-chair of the Arctic Human Health Expert Group, which advises the Arctic Council on this and Roberto mentioned earlier that the Rising Sun activities have been followed along with that. We had a meeting on June 10th in Umeå, Sweden, and the Rising Sun topic came up a lot. And there was really a lot of interest in continuing this circumpolar dialogue. I think during the Canadian chairmanship of the Arctic Council, they started an initiative on suicide, and we were really glad that NIMH continued it and really created a successful community of discussion around this, and the outcome from the toolkit is exciting. But there's a lot of interest among Arctic nations and the permanent participant groups on how to continue this work. It appears that Finland is going to, in their chairmanship of the Arctic Council, is going to focus mainly on the Sami population. So we're going to lose a little bit of the circumpolar dialogue and discussion about Inuit populations and Alaska Natives. So that's a concern that was raised by the group and how we can continue to work with this. The other thing that was raised by our Greenlandic colleagues is that the toolkit being in English is an impediment. They have trouble with internet connectivity in a lot of parts of the Arctic. And so opportunities to translate the toolkit and other materials into native languages, to make the materials available that they can be run off a computer disk rather than through internet connectivity, would be things that would be beneficial, and that we'd like to see more opportunities to where the Arctic Council could help with the promotion of the rollout of the toolkit. And so I'm sure Roberto will have more discussion on that. Another thing that came up is something, Roberto, that you mentioned about the lack of visibility of ACEs measures in the Rising Sun outcome measures. And ACEs are used very much in Alaska as part of the implementation of prevention activities, both in education and social welfare and child welfare support. And so that's been a major part of the activities in suicide prevention in Alaska, but they're pretty absent from the discussion on the Rising Sun. And some way to integrate that and think about ways of using those other tools would be of help. So those are some of the comments we got back from the Arctic Human Health Experts Group, and a real desire, I think, to continue the circumpolar dialogue. So anything NIMH could do to help with that would be really interested in collaborating with you on that.
Great, thank you very much, Tom, for that update. Yeah, one of my task items is to follow up with Haiti about some of the ideas and activities that Finland will likely want to promote. And what I failed to mention with respect to our toolkit is actually there's going to be an outside contract through the Mental Health Innovation Network. They'll be hosting the site and doing a launch webinar, plus some other opportunities for dissemination. I think we'll definitely sort of coordinate with some of our circumpolar colleagues. The health disparities that I am coordinating with Andrea on the Arctic resilience will probably be one of our Arctic partners, Arctic Council partners. And so we're definitely on top of that. And I agree, sort of the challenge about the translations, that was something that came up through the series when we were doing the Delphi exercise online. We were able to do a few translations, and some of our colleagues were able, kind enough, like Christina Larson from Denmark, to reach out to some of our the Greenlandic colleagues. NIH has a translation service that does Russian, so we were able to get some translations into Russian for it, but we understand that challenge, and we're trying to address that in a reasonable way. So thank you there. Anybody else? Updates, announcements? I can see some folks looking.
Thank you very much for beautiful presentations.
No, is that Ed?
Very, very nice presentation.
You're very welcome.
Ed's aware of this as well as Tom, but if you go to the LEO website when you get a chance and you log in, on the upper right-hand side, there's a variety of different languages that the LEO program is able to, including Sami, translate. And so that might be a potential tool to speak with Mike Brook or Mike Brubaker to get an idea how I might be able to use it.
Okay, great. Thank you.